Ciao, Vardians. I'm here on the mic for the question of the day, which is: which of the following is the median pay for respiratory therapists as of 2020, according to the BLS.gov? If you are new to the show, you may not know that in terms of I don't want to say pricing, in terms of realizing or comparing or getting an idea, a decent idea of what some professions make. I use the website bls.gov quite often. I use that myself when I was making the decision to become a PA or not, essentially what to become. And so bls.gov is using my go-to for certain things, and how much a profession makes is one of those things. Again, this is a median, and it's not accounting for different factors that usually affect how much somebody is paying, such as or getting paid, such as experience, their level of education, and their location, not just in geographically, but also rural or non-rural and so forth. So these are the answer choices. Is it A, 87,000, B, 73,000, C, 62,000, or D, 109,000? The answer again will be at the end of the episode. Y'all enjoy. Hey y'all, I hope you're well. Welcome to another episode of Healthcare Boulevard. This is a podcast where we shine more light on healthcare, and our goal here is to provide more options to people looking to choose healthcare as a career path, regardless of their background. My name is Sena Kakpomo, and I am your host and creator here. I thank you for tuning in. I appreciate your support. Remember, you can tune in on YouTube or wherever you get your podcasts. Without further ado, let's get into today's episode. Hello, audience. How y'all doing? We are back on the mic with another interview, another guest speaker. His name is Walter, and let's get it started. Walter, how you doing?
I'm doing good. Thank you so much for having me on the podcast.
Of course, of course. Let's start with you introducing yourself. Tell us a little bit about who you are and what you do.
Okay, so my name is Walter Plaza, and I work in the state of Florida as a registered respiratory therapist. I've been doing it for about almost 11 years. My career has kind of taken me a little bit everywhere. I started out in a very large teaching facility where it was a level 2 trauma for both adults and pediatrics. I later did a little bit of part-time travel, and then I ended in the Jacksonville area for about the last 6 years. And
Okay.
I've worked days, nights. I've kind of done a little bit of everything, but I've been on nights for about 7 years, and I've kind of stayed with it. Just I went back to school for undergrad and had a family, so it just kind of has adapted more to my lifestyle. But
Yeah. So you're a respiratory therapist. One thing that, and let me just put a full disclaimer here. I don't know too much about respiratory therapy, so I will be learning alongside the listeners, to be straight up honest with you. So I
and
may
that's
ask you
okay.
some questions that you're like, wait, shouldn't you know that?
Yeah.
I
No,
don't.
that's okay. To be totally honest, if we're talking about medicine in general, my field is brand new, and
Mm,
it's been out since about the late 40s, the
mm-hmm,
1940s. But as far as doctors have been around forever. Florence Nightingale was, the godmother of nursing, essentially.
mm-hmm.
So, and even like X-ray technologists have been out since, I guess, what, the early turn of the century when X-ray came out. So if
Right.
we're talking medicine in general, respiratory therapy is actually very, very new. It's the baby brother of the medical field. So a lot of people, when I tell them what I do, they don't exactly what I do, and I don't take any offense to it. It's just I didn't even know what it was until I was about to I had already gotten accepted into school for it before I even knew
Mm.
what it was. So
Wow. Okay, so that's the story I want to hear exactly. So tell us how you heard about respiratory therapists and decided to go into it.
okay, perfect. Yeah, so I actually started out as a nursing major. I did all my prerequisites for nursing, which was about like a year and a half or so. I was
Mm-hmm.
in nursing school already. It was in my first semester, and I got into it, and my heart really wasn't into it. And my nursing school was kind of strange. From what I've been told about nurses, my nursing school was not like any other place I went to. There was a portion in my schooling where we had to shadow different fields within medicine in order to like get an appreciation for the field for like healthcare and working as a team. Like, you know, even though like we all have separate areas, like doctors, nurse practitioners, PAs, you know,
Mm-hmm.
lab techs, like we had to have an appreciation to know that we are still all working for the patient.
Mm-hmm.
So when it was my turn to shadow, I remember I shadowed an X-ray tech, I shadowed a respiratory therapist, and a paramedic. So when I got to respiratory therapy, I was really intrigued because they did a lot with quick decision making in critical care situations and emergency situations. They weren't stuck in one area. They got to move around a lot more freely versus like a nurse. So when I got to it, I saw I'm a gadget guy, like I like gadgets. So
Mm.
they got to use you know, life support machines or ventilators. They got to, you know, do different type of therapies with different types of equipment, machinery to kind of help patients breathe better and that type of thing. So I
Mm-hmm.
remember when I got back from all of my rotations, there was about 50 kids in my nursing class, and 12 of us changed fields in nursing school. So that's how
Wow.
I ended up getting into or wanting to change majors. And
Mm-hmm.
then I applied to nursing school, or I didn't drop. I finished the nursing semester because I just wanted to at least finish it because I was already halfway through it. And
Right.
then when I didn't enroll the next semester, I just applied for respiratory school and got in for the following semester. So that's how I ended up in respiratory.
Wow, that's quite a story. To not know about something until you're essentially there, and now you're like, that's my thing. That's what I want
Yeah,
to do.
yeah.
That's pretty cool. So, at that point, then, what was some what did you have to do to actually get into
The
respiratory
school.
therapy? Yeah,
Okay.
respiratory school.
So most of these allied health um, type of fields, like X-ray, respiratory nursing, they all have very similar classes you have to take. So a lot of it has to do with, you know, some advanced math, like statistics and stuff. You know, human anatomy and physiology. You know, both parts of that. I had to take microbiology,
Mm-hmm.
chemistry. A few of those. Those are kind of like your core science classes. So they're all about the same. But once you get into the school, it's most schools are a 2-year program, and this is where we're different from a lot of fields. When I went to school, I had to take 3 tests in order to get my title. So my
Mm-hmm.
first test was called the CRT, your Certified Respiratory Therapist Certification. So that's a
Mm-hmm.
written test. Once you pass that, then you have to take what's called your registry written exam, and that's another test. That's 100. Both of them were 150 questions. So
Okay.
my next test was my registry written tests. And then your third test was your clinical simulation. Now, as a respiratory therapist, you know, I can walk into any hospital at any time, pre-pandemic and during pandemic, and it could be like a general floor for nursing care. And I
Mm-hmm.
could see anywhere from 3 to 10 nurses, depending on how big the floor is. Generally, depending on the size of the hospital, there's only a handful of us. So I work in a very
Mm-hmm.
small hospital currently. It's 150 beds. So
Okay.
there's 4 people for the day shift and there's 3 of us for the nights to cover 150 beds. So we have to cover a lot of area.
Mm-hmm.
Because of that, my job is very proactive in my field where we have a lot of protocols and autonomy to make decisions without the doctor being there. So I can
Mm-hmm.
order medications, I can order an X-ray, I can do a lot of things by myself, but you have to have those critical skills to in order to do those things.
Right.
Um,
No,
so sorry, I know I kind of got a little off track, but
no, you're
so
fine.
that's so once you take so go back. So once you take that clinical simulation, then you finally have earned your RRT, or that's your um you know, your registered respiratory therapy.
Mm-hmm.
Um, so now you can go and practice after that.
Okay. So is those 3 tests you're taking those after you've gone through the respiratory therapist program,
Correct. Yeah.
right?
So like the nursing has like the NCLEX, and
Mm-hmm.
from what I've been told, now I don't know for sure, but when I've been told, if you score high enough, you can usually become a nurse within 80 questions. Which I'm not downplaying nursing. I
Yeah,
never would, but
yeah, it
it's just
depends on like how you answer the question.
how
Yeah,
you
yeah,
right, yeah.
yeah.
So for us, it's not like that, but because our field has been meant to make more critical decisions, we really have to be tested very very hard
Mm-hmm.
in order to even gain those skills. So
Yeah.
that's why our
Yeah.
field is much different than a lot of
Yeah.
other allied health fields.
Yeah. That's quite interesting. Three tests. The most I've heard thus far has been two, and that was pharmacists. They have to take the pharmacy test and then the state test because they
Right.
have to take the law. But for you, it's three. So you are winning this game. The Emmy goes to you for sure. For
Yeah, it
managing
is.
to take
It's kind of rigorous.
yeah, it's a lot. But you so now you're a respiratory therapist, you're working in a hospital. Who else is in your team, like in terms of health? What other professionals are in your team in that decision making process?
Okay, so it's an interdisciplinary team is how we basically work. So I
Mm-hmm.
work alongside the nurses, and I work with the doctors and mid-level providers like PAs and nurse practitioners and such.
Mm-hmm. Mm-hmm.
So we all kind of communicate and make decisions best for whatever the patient needs at that moment.
Mm-hmm.
So like essentially the doctor makes the plan of care, then and he can write all different types of orders, from nursing orders to respiratory orders, physical therapy orders, all that stuff. And our job is to carry those orders out. A lot of the times, though, there are times when patients don't do well for whatever reason, and then they usually will call us to further assess. Nursing. Nursing is basically the jack of all trades.
Mm-hmm.
They know a little about a lot. We're the opposite. We know a lot about a little.
About yeah.
So our main job is heart and lungs. That's we're cardiopulmonary. If you actually look at a lot of our classes, like I had a whole semester of hemodynamic monitoring. So that was
Mm,
whole semester of just cardiac monitoring. So that's
mm-hmm.
16 weeks of in-depth, of learning balloon pumps and learning
Yeah.
different pressures of the heart and that type of thing. So that's stuff that we learn versus like how a nurse learns, because they have to know so much in such a short amount of time.
Right. Right. So in that setting where you're in and you're looking at different things, what are some of the diagnoses of that the patient have or some problems they have that you were helping them deal with?
So and usually anything that has to do with like a chronic lung disease, so something called COPD, that's
Mm-hmm.
usually one of our biggest patient demographics.
Mm,
Asthma, patients with a disease called bronchiectasis or cystic
mm-hmm.
fibrosis, those are usually our biggest ones that we see are the chronic ones. But we also see some things that are very acute. Congestive heart failure are a lot of our patients, where fluid can be backed into the lungs very easy.
Mm-hmm.
Patients that have pneumonia and obviously COVID.
Right.
That's
Right.
probably where the most awareness has come from. COVID is in my profession now. Um,
Mm-hmm.
so it's hard to say I thank COVID for that, but COVID has probably been the biggest marketer of my field
Yeah.
since it
Yeah.
started.
And a good question after that is how has COVID affected your field in terms of your just not necessarily, putting your field on more so knowledgeable people hearing about your field, but how has it affected your day-to-day work?
It's been very difficult, if I'm being
Mm,
totally honest. Our field was already very short as it was. In the entire country, I think there's only 200,000 or 250,000 of us anyway. There's probably triple that for nursing, and nursing has a huge shortage too. But
mm-hmm,
I believe our shortage is almost close to 30%. We're about 30% low, and that was before the pandemic.
mm,
So it has made it difficult. We've had to have do a few things that would probably not we wouldn't do on a normal situation, but because we have been on such a crisis, we've had to make very radical decisions in order to have the best patient outcomes.
mm-hmm,
um,
mm-hmm.
but it has gotten better, the last month or so.
Right.
This variant has kind of started to go downhill, and it's gotten a little easier to kind of get back to normal. But
Yeah.
unfortunately, we don't know what the long-term effects of all this stuff is, so who knows what's down the road.
Yeah. Yeah, that's the lingering question is even those who had mild symptoms, like, and that's using my demographic because I'm in outpatient, is most of the patient I'm seeing, even with COVID, they have mild, symptoms like your eye symptoms, and they get rid of it in like a week or so. But I am hearing more and more like we really don't know what the lingering
side effects or the long-term repercussion of just simply having COVID in your system at some point in your life. So
Right.
we're keeping our fingers crossed.
Oh, yes, we are.
That's all I can say right now. That's my professional hope.
Yeah. Yeah, yeah,
Um,
exactly. Yeah, just try to keep it even keel.
yeah, exactly.
Yeah.
So, if you were to describe a respiratory therapist to somebody like myself or other folks who've never heard of it, how
Mhm.
would you say it?
My favorite term is the nurse's best friend,
Mm,
because we always get called in an emergency.
mm-hmm,
So normally I would just tell people that I usually help people that have some type of breathing problems. But on any given day, I could be there to help assist in a high risk delivery of a new baby. I can be there for someone that needs is coming from the emergency room that has maybe a broken or a dislocated shoulder, where I have to help the doctor assist with like a what we call a conscious sedation, where we sedate the patient, but they're not out completely. But I have to monitor their breathing, for the doctor
mm-hmm.
while he puts the shoulder back in place. So my field is very all over the place, but predominantly, if you are having problems breathing, I'm the one that you're going to see first.
Yeah, yeah. Healthcare providers are generally, and I was joking with my husband yesterday about, well, if your friend need to see me, then likely they're not doing okay. But that is even more so strongly for you because you are dealing with some of the most critical things like breathing. That's basic, like you need to do that.
Yeah, yeah.
So
If you're
by the
not
time
breathing,
they're
you're not
seeing
doing
you,
a whole lot of anything else.
yeah, exactly. By the time they're seeing you, it's going bad for them. It's real going bad for them. And
Yeah.
you're a lot of time. So how do you like your job? What's your favorite part about it?
Oh man, I just like seeing people go home. Like, and I know
Yeah.
that sounds kind of cliche, but there's nothing better than seeing someone that came in. Maybe they were what we call fluid overload, and they had too much water in their body essentially, and their lungs are backed up. There's nothing better than seeing the aggressive therapy you give them, maybe in the emergency room, than being in the hospital for a couple of days, than going home. Because whether no matter what type of person it is, all these people have families, or they're all part of a family.
Mm-hmm.
They're all someone's mom, dad, husband, wife, brother, sister. All these people have someone that loves them. So there's
Mm-hmm.
nothing better for me to see than someone going home, way different than when they came in.
Yeah, yeah, they're actually able to go home. And so what are some challenges?
Oh man. Well, so I'd say the two biggest things right now are my field being underutilized,
Mm,
as well as awareness. And what I mean by
mm,
underutilization is we in the state of Florida, for instance, we have, from again what I've been told is, we have a lot of things that we can do here. Like I'm able to independently intubate, which means, oh sorry, my allergies.
it's okay.
I'm able to independently intubate, which means put the breathing tube down you in a life or death situation.
Mm-hmm.
Um, Mostly that's typically reserved for physicians or mid-level providers.
Right.
I can do central access, which means I can put in IVs. I can put
Mm-hmm.
in an IV into your artery to monitor your blood pressure. I can even put in what's called like a PIC line or a midline, for maybe intravenous medications over a long period of time.
Right.
Um, Nursing has a lot of those fields too, but as
Mm-hmm.
someone that's not a nurse, I'm able to have dual enrollments of those responsibilities, as well as monitor life support machines as well.
Mm-hmm.
So I'm very lucky where I have been working in the state that I work in, because I can work pretty much within my entire scope of practice.
Mm-hmm. Yeah. And what are your essentially some things you do to keep your education up to date?
So by law, and even if it wasn't by law, most of us would still agree to this anyway, we have to have at least 12 hours of continuing education a year to
Mm-hmm.
keep up our licensure, as well as to keep up with medicine. Because people like to say that medicine is a science. It's not really a science. Yes, there is scientific data to support it, but it's more of an art, because it's always changing.
Mm-hmm.
Art is always changing. There's always different artists that have a new um I don't know what you would call it, but I guess some type of skill to a
Yeah.
painting, whatever. And
Yeah.
medicine is very much that. For instance, we, for a long time, we, didn't have, antibiotics, and then all of a sudden, moldy bread turned into penicillin,
Mm-hmm.
for lack of a better term. So
Yeah, yeah.
so everything is always evolving. So we have to keep up with the time. So we have to have so many hours a year, and for us it's 12 hours every year of, going to lectures, reading articles, participating in some type of like survey, just to keep up with how medicine changes in our field.
Mm-hmm, mm-hmm. And how walk us through your day-to-day work life essentially when you go to work. Walk us through it.
Okay, so typically what comes in, we work 12-hour shifts in the hospital.
Mm.
So
Is that what
usually
you
I
always do? 12 hours?
I usually do 12 hours,
Okay.
3 days a week, and then
Mm-hmm.
I have a part-time contract job as well. but
Gotcha. Okay.
if I'm in the hospital setting, yeah, we do 12-hour shifts. So my shift starts at 6:30 p.m. at night, and then it ends at 7 a.m. the next morning. So
Okay.
I'll come in and I'll talk to the previous shift, and my facility, we usually carry 2 critical areas. So I usually will work either like in the ICU or the emergency department, and also have like the NICU, which is the neonatal intensive care as well.
Mm-hmm.
So if I have, let's say, the ICU, and I have patients that are on life support, I'll go with the previous shift therapist, and we'll go into the ICU and go kind of room to room, and talk about what size breathing tube they have, what type of machine they're on, what are the settings in the machine. Um, Drugs is really important. I know that doesn't really sound like something for us because we don't deliver those type of drugs, but I need to know what type of pain medicine they're on, what type of sedation they're on to keep them comfortable on that machine. Because that's gonna kind of tailor to how I deliver their care throughout the night into the next morning. Because a lot of the times these patients, they didn't come in with a breathing problem, or if they did, our job is to get them off and get them home. So like,
Mm-hmm.
what is the plan of care? Um, After I've received report, um, I'll go to like the next place that I'm covering, and usually like we carry basically cell phones with us, through the hospital. So I'll
Mm-hmm.
call, you know, the 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 neonatal intensive care nurse, touch base with her or him, and find out if there's any high risk moms that are in that are going to be delivering soon, so I can kind of plan out my night.
Okay.
Um, so that's kind of usually how it starts.
Okay. That's how we start. And for you, what are some professional aspirations?
Well, I still am, I've been doing this for a while, but I'm still always learning.
Yeah.
About a year and a half ago, I got an advanced credential that
Mm-hmm.
I've been putting off for probably about 5 years. And I finally got it. So I'm very happy about that. Um,
Congrats.
Thank you, thank you. So that one is called the ACCS, which is the Adult Critical Care Specialist,
Mm-hmm.
and it basically is a competency test makes you that will help you gain, some more skills, but essentially certify that you are competent to work in that area. So
Okay.
that's kind of where I specialize in. But there is another one I want to get. I do work a lot in the neonatal intensive care one. So there's one I want to get called the NPS, which is the neonatal pediatric specialist. So that's the next one that I'll be working on after
Mm-hmm.
that.
And that's sort of answer my question, which was you what demographics do you work with? It seems you're across the board.
I call it from womb to tomb. So I go on any given night, I can go from, a newborn all the way up to a patient that's 100 years old. So you
Mm.
have to be able to, your communication skills have to really be in par, because
Mm-hmm.
you have to know how to talk to somebody who's, in their 70s that or their 80s that came from, that older generation where they're very kind of, a lot of them are very reserved. They're only talking about their health. Um, Unfortunately, because of the times that they're growing, a lot of them don't like people, of color. I'm ethnic, so that sometimes has a
Yeah.
big part of it. Or sexism, if it's
Mm-hmm.
sometimes if it's a female, provider talking to a patient, they don't feel comfortable talking to the female. Sometimes I'll come in and, I'll just sit next to them, and maybe they'll tell me something that they didn't tell the provider. And then you
Mm-hmm.
have
Mm-hmm.
to go all the way down to being able to talk, Mickey Mouse to a 2-year-old or a 3-year-old. So you have to be able to have those type of skills to be in my field. That's where, kind of like I said, nursing can be a little luckier, because if you just want to be like with adults, you can just stay with the adults. But
Mm-hmm.
unfortunately, I have to be able to do from from the very bottom to the very top.
Right, right. You have to know it all. And just in a more of a general sense, what are some growth and leadership opportunities for a respiratory therapist?
Um, there as much as you want. You know,
Mm,
you can talk to a few different people in the field, and they'll say that our field is kind of closed off, but it's really not. So there's a few, so I've been doing this about almost 11 years, and there's things I still haven't done. So one of the next things that you can do is called PFTs, which is a pulmonary function technologist, and
mhm,
that's kind of where you go and take a breathing test. It's usually on an outpatient type of setting,
mhm,
and you're put into this kind of machine, and you breathe through this glorified straw, and that will test the mechanics in your lungs, or basically what type of disease you have in your lungs.
right,
You can
right.
also do bronchoscopies, which is instead of going like an endoscopy, which looks at your GI system. Bronchoscopy will map out your lungs. They do
Mhm,
everything from um, you know you know essentially what we call like a bronchial washout, which is clean out the lungs of mucus, to even doing like ultrasound technology where we can stage lung cancer and
mhm,
stuff
mhm.
within the
So,
lymph nodes of the lungs. So
right.
there's quite a bit. Education, management, consulting. I mean,
Mhm.
it's healthcare, so really the sky is the limit.
Yeah, yeah. So, you did mention that you have a consulting position as well as the hospital one. What's the
Yes.
difference? What the dynamic there?
It's been a big learning curve.
Yeah.
So I work for a small startup medical device company called NEVAP. I'm a clinical account manager for them. So it's a brand new role for me. It's
Mm,
nothing like patient care. So a lot of it has to do with education and essentially sales. So it's definitely been a big learning curve, but the owner of the company has been more than over the top helpful. So I'm just
yeah.
kind of starting getting my feet wet into that. But it's definitely more the business side of healthcare
Mm-hmm.
versus the patient care side of healthcare.
Well, that's exciting. That's exciting. Um, and what clearly your position comes with a lot of stress, as a lot of us in healthcare deal with, and just across the world right now. How do
Yes.
you cope with stress?
So um, obviously the pandemic really elevated it quite a bit. And there
Mm-hmm.
was a point where I was questioning if I could even do this any longer.
Mm-hmm.
Um, and mostly around that Delta wave. I mean, there was a point that I remember that a lot of our staff had come down with COVID, and we were so extremely short that I was me and the critical care doctor at night were running almost 40 ventilators between the two of us. And if you talk to somebody that has done this, they would probably call me a liar, but it definitely was not a lie. It was very super super stressful.
Wow.
Um, but it made me appreciate more of just being here, because unfortunately COVID doesn't discriminate. It didn't discriminate. It could it was taking people away from all types of ages. It didn't matter if
Mm-hmm.
you're young, old, or healthy or unhealthy.
Mm-hmm.
And when COVID first came out in 2020, and my daughter was only about 6 or 7 months old. So as the year progressed, it just made me like try to fix my priorities, like really appreciate like every day, which sounds so cliche again, but like you don't realize like how fast it can be taken away from you. Like it can be taken away like that. So
Yeah.
you have to appreciate just every day. So me, I just spend time with my family, and just really appreciate like every little moment. Um, like I think I took her to Disney a couple months ago for her birthday, and just to see
Oh,
like her face like light up and when she saw like
yeah.
Mickey and all those all those characters that like we read about, like just
Yeah.
totally
Yeah.
just made me feel like such a good feeling.
Oh, that's
Um,
exciting.
yeah, so really just like I said, just appreciating like every little thing, or my favorite thing, like my my wife's Puerto Rican, so we drink a lot of Caribbean style or like Cuban coffee in the house. So
Mm-hmm.
so in the morning I'll get up if I'm off, and just the silence of the morning before
Yeah.
everybody's up, and I'm making coffee, and just having that, appreciating like that aroma, that
Mm-hmm.
stillness of just having like myself, that coffee, and just like looking around and understand like this is what life is, just appreciating every moment.
Mm-hmm.
So I feel like
Mm-hmm.
if you kind of just look at things like that, any bad situation, you can make a good situation.
Yeah, yeah. No, that's much appreciated. And what do you do for fun?
So I recently got into archery. Um, so I just purchased a bow a couple days ago, or I think Monday I did. So it's coming in tomorrow. So I'm very, very excited to to get
Oh
that. So
my gosh.
that'll be my next adventure right now is to, learn how to shoot a bow and arrow. But
Oh, that
um
is so exciting.
yeah, I'm really excited for that. I do enjoy a lot of things outdoors. I enjoy
Hmm.
biking. We try to do things like on the weekends when I'm off. So when it's warm outside, like Florida has like a lot of natural springs, so we'll go like to the springs, do a lot of swimming, obviously a lot of beaching and stuff like that. But
Hmm.
yeah, mostly archery is gonna be my next adventure right now.
Yeah. Okay. I feel like I might have to check in with you in a couple months just to be like, how is it going?
Yeah, for sure.
Just to hear the stories of archery from you.
Yeah, yeah.
But that no, that's very exciting. Last question before I let you go. What word of advice may you give to somebody who's looking to become a respiratory therapist?
Well, I probably say the first thing is, if you think it's something you want to go in or healthcare in general, just know your sciences. If respiratory is something you really want to get into first, I would definitely shadow somebody because, like I said, I was already in nursing school planning to become a nurse. Like I was like, oh, I'm gonna be a nurse practitioner one day, da 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 da. And then I got into it and just realized this is not what I wanted to do. This is not what I expected it to be.
Mm-hmm. Mm-hmm.
So I would definitely say find someone that you could shadow.
Mm-hmm.
And the way you go about that, find a school that has a program and ask if there's a teacher you can talk to or some place where you get placed for like a job shadowing opportunity and kind of go from there.
Mm-hmm.
Once you're in the field, no matter what type of facility you work at, whether it's a 1,000 bed teaching facility or a 50-bed community hospital, you have to find a mentor. And fortunately, I've kind of noticed this with some of our younger hires. They kind of think they already know everything, which is okay
Mm-hmm.
because we all have that stage where we're pretty smart, as a student. But when you get out into the real working world, it's very, very, very different. So
Yeah.
find someone that's been
Yeah.
doing it for a little bit that you can kind of mentor you, show you the right way to do things, the wrong way
Yeah.
to do things. Like I said, I've been doing this almost 11 years and I have a 30-year veteran that I work with, and I learned something new from him like 2 weeks ago that I had no idea. And,
Mm-hmm.
and now like I've put it into practice and it works every time.
Yeah.
So
Yeah.
find someone that can kind of mentor you to show you the ropes.
Yeah. No, that's advisable. I mean, you're right. A lot of time we do feel like we know a lot, especially as new grads. But the way I look at it is we know a lot of the science and some of the art, but the real art is really learned with experience for real. That
Right.
you can learn that in the books. The art cannot be learned in anatomy and physiology or gen med or what have you.
Yeah.
And so somebody who's been doing it for years will have picked up some tricks and some advice as far as what not to do, even though the
No,
book said
exactly.
A, maybe C is better in reality.
Right, right. Oh God, I hated those questions.
Oh
Is it A?
yes,
Is it
oh
B? Is it
yes.
both? Or is it none? I'm like, oh man, really?
Okay, we started on test. Okay, that's a
Yeah.
whole trauma for me. But I do this sometimes when I'm so excited that I get to the last question, but then I was like, wait, hold on. There's a couple things that means. Can you clarify for us what is the educational requirement? So, is it a bachelor's degree requirement, a master's? What's the requirement for
Oh,
becoming a
yes, that's right.
respiratory therapist? Mm-hmm.
So your entry level is usually like a 2-year program typically. So
Mm-hmm.
I usually tell people it's 3 years if you don't have any college experience or you're a non-traditional student. It's usually about a year of prerequisites, 2 years for the program. Once you take your boards, you can practice essentially with a 2-year degree.
Mm-hmm.
And then, they even offer up to a master's in respiratory care. So that's kind of why I said it does mirror nursing. It's, we're not a nurse. So I like to clarify that we're not nurses, and trust me, some of the best people I work with are obviously my nurses. But it's real similar as far as degrees. You can get into it with a 2-year degree or it can go as high as a master's level.
So I've heard of the like RTC and then they're like two different types of respiratory therapists? Is that the case, or am I dreaming?
So no, you're correct. There are actually now three types of respiratory therapists. So there's called
Okay.
your entry level is your CRT, and it's essentially the same job, but there are a few things that in the coming years that they're going to no longer be able to do. One of the big things that around 2030 is that they will no longer be able to take, and again, this is just from my understanding, around 2030, our national accrediting body is going to change it to where those CRTs will no longer be able to take verbal orders from doctors, which a lot of those things, a lot of verbal, like I'm given so many verbal orders on a daily basis that I can't keep count of it. So that's huge. That's huge. But as of right now, in 2022, you can still get your entry level CRT, your certified respiratory therapist, and work. I'm a registered therapist, so that's that double test I was talking about that I have to
Okay.
take. And
Okay.
then there is a brand new program that started about 2 years ago. No, I think about a year ago, 2 years ago, because they just graduated their first class. Ohio State offers a mid-level position. So that means that they are a respiratory therapist that has the same practices and rights as a nurse practitioner or a PA. And that's a brand new position. Like I said, I believe Ohio State just graduated their first class in December. So we're not sure where that's going yet, but it's very exciting for our field because it's something that has been needed for a while.
Yeah.
And but that field is more catered to work in acute care, which means work in the ICU setting or more work like in the ER setting right out of
Okay.
school versus a nurse practitioner or like a PA's.
Okay. And so for that, is it set up in such a way that you have to hold, for example, your title as a registered respiratory therapist before you can get the mid-level
Correct.
accreditation? Okay, that makes
Yep.
sense. So it's sort of like a scale, right? You
Yes.
start at the bottom and then you make your way up if you want to.
Yep, if you want to. So
Okay.
I'm hoping, my goal is that if they start opening a couple more schools, that's the route I would kind of like to be able to go for the most part.
Yeah, that's fair. That's fair. Okay. Well, I guess that ended up being my last question. Thank you again so much for joining us, Walter. I appreciate you taking the time from your beautiful Saturday and from your babies and your family.
Oh, no problem. Like I said, it was a total honor. Thank you so much for reaching out.
Thank you so much and have a beautiful day.
All right, you too.
All right, bye.
All right, bye-bye.
All right, je suis de retour. The answer is C. According to BLS.gov, as of 2020, a respiratory therapist makes about $62,000, and that's again the median pay. Keep in mind that's the entry level, and we discussed with Walter, that as a respiratory therapist you can start as an associate and go as far as right now a master's. And so this pay is relative to when you're getting in experience and all of that, as I've mentioned before. I don't want to repeat myself. That's it. Bye. Alright, that's all I have for you today. Thank you again for joining me. I appreciate you. Please subscribe, follow, like, comment, and share. And stay blessed.